Hey everyone, this is Ben Thompson, audiologist and tinnitus specialist. We are here for the Tinnitus Virtual Summit, and we're here with a special guest. This is Torin Brazel, who is the CEO of the American Tinnitus Association. And I'm going to switch the camera over to give a nice introduction for her. And then we're going to ask her some questions, and she's going to help us to figure out how does an individual live with tinnitus. If you have tinnitus, this is going to be helpful for you. Also, if you're a professional, we're going to talk about the resources that the American Tinnitus Association can provide for us. So welcome, Torin. How are you doing?
I'm doing great. Thank you for inviting me. I'm very excited to be on the summit.
You're very welcome, and we love your background. I've lived in the San Francisco area for many years, so I think it's awesome that you chose that fun background for our talk here.
You're welcome.
So first, I would like to open the floor for you. And would you mind giving us an update about what the American Tinnitus Association has been doing, and especially during these times of the COVID-19 pandemic? How has the American Tinnitus Association been changing the messaging or changing the services for your clientele?
Right. So the ATA has been a virtual organization since 2016. It was originally established in Portland, Oregon, and the board of directors voted to change it to the Washington, D.C. area to be closer to NIH funding, DOD, and Congress. And when we had the office in Portland, we decided to create a virtual office in the D.C. area. One, it saved a tremendous amount of money. We have people from all over the U.S. that work for the U.S. in a consultant role and staff role. So in the COVID-19 world, there was not a blip. Everybody already had everything established. I did ask everybody the first week of March to make sure that all their materials and equipment were available, because I knew that the supply lines were going to be squeezed. I had been reading about COVID-19 at the time. It hadn't been named as such. It was Corona at the end of December. So I knew that things were going to be pretty bad coming up. I had never read anything like this in my career. So how we changed our messaging is we knew that people were going to likely become more anxious. And we decided to send out emails and place kind of little info bites on our website and provide tools, so that you would know maybe Zen, listen to an app named Zen to try to calm you down. If your tinnitus was really bad, we have a program called the Tinnitus Advisors Program, and we had an email about that. Please call in. We have 7 audiologists that answer questions and kind of go through a brief, who have you already seen, what have you already done. We had the biggest thing we did is we made available the spring issue of Tinnitus Today, The World in Chaos, free to the world. And this is something that is behind our paywall, but we knew that this issue, which dealt all on mental health, was something that our tinnitus patients, and actually those that have mental illness, would benefit from. So last year, the editor and myself, we planned the themes for the next year, and it ended up that spring was mental health. It wasn't something that we had planned specifically for COVID-19, but it perfectly dovetailed in with that. So we made sure that all of our staff knew whatever you need to do, get them to an audiologist on our TINAP program, give them the tools that they need. But basically, the TINAP program and the Tinnitus magazine have been very well received.
Thank you for sharing that. That's great. Thank you for helping lead the way of giving some free resources, some additional free resources like the Tinnitus Today magazine spring edition to the community during these times where we have less social stimulation and we have more time with the internet. So thank you for that. And yeah, I wanted to bring up what's important for someone listening who may have tinnitus but not know much about the ATA or about which is the American Tinnitus Association, that there are some amazing free resources for them. You had mentioned that you do offer a phone support system to answer some questions. Is that for ATA members or is that for anyone?
It can be for anybody. Anybody who calls. If the staff is unable to help you for example, say, you know what, we have a whole sound library, and this is where you find it. Or we have specific apps that have been rated highly by our support groups. This is where to find it. Or, oh, you're in this area. We have a support group in this area that you could go and listen and meet with other people with tinnitus. So there's a lot of things that the staff can do to help. But if it's at a point where we feel the audiologist needs to step in, then the audiologist that's on call that day will call that person back usually within 24 hours or less.
That's wonderful, because there's so many resources on the internet sometimes for an individual who may be looking for some direct guidance with their tinnitus. Sometimes the best thing to do is to get a real person or a real professional on the phone to say, okay, I hear you. This is what you can try, A, B, or C. And that's a great service. Thank you. You'd also mentioned the support groups. Would you mind giving us some history about the ATA relationship with these local support groups all over the United States?
Sure. So the ATA was established in 1971, as I said, in Portland, Oregon, by Jack Vernon. And he knew over time that he was not going to be able to reach the millions and millions of people that have bothersome tinnitus, which is around 15 million right now. Not only is it the number one disability for veterans, second is hearing loss, but it's also one of the biggest diagnoses in the United States is tinnitus. So we decided, or at the time they decided, to create in different cities tinnitus support groups where you could go maybe once a month, once every 2 months, and meet with people who have had tinnitus, who have either habituated from tinnitus, or somebody who wanted to give back to the ATA and lead a support group, and some have led for 7 years, 10 years, 15 years, these leaders. A lot of times people may want to be one-on-one with somebody, and going to these tinnitus support groups, you can sit in the room and you don't have to say anything. You don't have to participate. You can listen. And normally there's an education component. So there's a speaker that might talk about the Levo system. You might have somebody talk about tinnitus retraining therapy. So sometimes it's educational, sometimes it's just sharing. And just recently, as of this last week, we've started virtual support groups. And our very first virtual support group was held in San Diego last week, last Wednesday. So we're more and more virtual support groups will be coming online. And that's where we're going to grow our support groups.
That's great. For anyone listening who wants to find or be introduced to a support group, there's a great resource on the ATA website. If you just search American Tinnitus Association, find local support groups, you'll get a nice list with contacts, and that's the great resource for you there. So you've been working with this organization, the ATA, for how many years, Torun?
Close to 4. Prior to this, I was with the American Board of Audiology and oversaw the credentialing of audiologists in cochlear implants, pediatrics, and board audiology. I also was the person who developed the preceptor program for audiologists for their 4th year so that the preceptors would be trained rather than going to maybe a private practice or a medical group where they had not been trained prior. And also the tinnitus management certificate. Started that. I was unfortunately unable to complete that because I joined the ATA, but I'd been in the tinnitus world since 2011.
Wow, thank you.
Yeah.
And what are the trends you've been seeing, or over these almost 10 years working in the tinnitus world? Are there any recent trends or any notable observations you've had about how people are coming to you, or what resources are people looking for, or what kind of treatments are more effective or more accepted by the community? Any comments on that?
Sure, there's a lot to unpack there. The one thing that hasn't changed is the question is, are we going to have a cure? That's the number one question. And then the second part is, what is the research that's been doing? And we purposely changed our mission to finding cures because we felt that it really is probably not likely going to be one cure that is going to cure 15 million people. That maybe we'll find a cure, the researchers will find a cure for 2 million, or a specific type of tinnitus. That hasn't changed. But we do know that it likely will come in cures down the road. Let's talk about healthcare providers first. So for audiologists, when I was started in the audiology world in 2011, it was unheard of, really, for audiologists to really understand tinnitus. A lot of the AUD programs did not cover this in quite depth. Many audiologists were scared of it. Many audiologists did not understand how they were going to make a living seeing tinnitus patients, since intake is 1.5 to 2 hours, and then continually after that. So with the tinnitus management, one of my goals has been to educate audiologists that they really are the group that should be the ones to see. I mean, you have your audiogram, you have ABRs, you have all sorts of things that you can, figure out, do they really need to see an ENT? Sometimes you do need to see the ENT, of course. But now audiologists are understanding this is an area that is likely never going to decrease. You have young kids, young adults with, earbuds that are blasting, and they're just hurting their hearing, and they're also causing tinnitus. So it's not going to be something that goes away. This is an area of your life, and audiologists need to tap into taking care of them, helping them manage it. So I see more and more audiologists call me. I see more and more audiologists become professional members of ATA. I'm on the speaker circuit. I'm asked to speak on business models for audiologists. So that has definitely changed. It is not for everybody. And I always say that in my talks, that this is, if you're interested, but you decide not to, that's okay. What I want to teach you is who to refer to. That's the key, is how do you refer and build your referral circle. As far as patients are concerned, I have to say I've not seen one single thing change. Same questions, same anxiety. We try to be the place to go for reliable, valid information, but it is the tinnitus patients. They're so anxious, they just want to get on the internet and read every single thing they possibly can. And if somebody says magnesium works, or ginkgo biloba works, or vitamin D works, or, we're there to try to educate them and tell them that maybe that does work in a placebo type effect. But there really are two ways that have been proven by the Otolaryngology Association, AAO, to not fix but treat tinnitus, and that is cognitive behavioral therapy and hearing devices / with a tinnitus masker, because sometimes hearing devices work without a tinnitus masker. So that's really hard to hear for patients. They want things to be, I want this to go away. I want my life to go back to the way it was. So I have to say that has not changed. Mm-hmm. Research, I have seen more and more money being put aside for research. NIH last year funded 3 major tinnitus research projects, which the prior year they had only researched 1. ATA, we are part of the Congressional Hearing Health Caucus. I always forget the word health. And we're in front of congressmen explaining to them how important tinnitus is, that people, there's so much lost in a person's life. Sometimes they can lose their jobs, they lose their focus. So it's really important that we accelerate this funding area, but funding still lags others because it's hard to figure out, where is tinnitus? Is it audiological? Is it neurological? We try to put a lot of effort into education for prevention, but that's really hard. How do you tell young people they can go to the concerts, but you've got to wear these musician earplugs and save your hearing? So I go to about 30, 40 concerts a year, and I bring my cards, my business cards, and I bring hearing hearing plugs, ear plugs. And also I have my own set of special molded musician earplugs. And wherever I am, I'm educating people, but it needs thousands and thousands of Taurens to do this. So as far as tinnitus is concerned, I think more people know what it is, but we're still, I think, in the infancy of education and preventing it.
Thank you. It's tough when prevention is the most effective thing to do, but it's the hardest to implement.
Absolutely.
And you said you go to many concerts a year. Is that working a table with the ATA, or is that for your own personal enjoyment?
It's completely my enjoyment. I love EDM, love trance, love all of that. So you can imagine how loud it is.
Wow, that surprises me. I have some similar music interests, and definitely a place with a lot of loud noise where wearing earplugs is very important. So I have two final questions before we wrap up our interview here for the Tinnitus Virtual Summit. And first I have, what kind of advice would you have for a professional interested in serving tinnitus patients? Let's say an audiologist who may be watching this, who has an interest in working with more tinnitus patients. What kind of advice would you have for them about how to start that process?
The first thing I would do is I would say, just call me. And I will give you some names of people who've set up practices so you can look at different business models. I'm happy to share my presentation, which shows the models, which also asks a set of questions so that you can determine whether you really do want to see tinnitus patients or not. So that's probably the first thing to do. I'm happy to speak to audiologists. I love audiologists. It has a special place in my heart, audiology, and I'm happy to speak with anybody. There aren't that many audiologists that are going to, storm my door. So I have the time, and I want to talk personally to each and every one of you. Second, of course, is to become a member of the ATA, a professional member. We have a magazine that's has an incredible reputation because it tells personal stories about tinnitus patients, so a healthcare provider can really understand what these tinnitus patients are going through, how they came out to the other side. Sometimes we have some success stories. We have a lot of tools that are in the magazine for healthcare providers. And we also provide multiple copies to each provider that they can put into their lobbies. We also provide it in digital, and they can send that digital copy to their patients and say, hey, I'm starting in the tinnitus area, or I'm interested in seeing patients, or if you've seen and started your own tinnitus management clinic, you can send the digital copy off to your patient, and it looks like, hey, look, I know, here's some secrets, here's some tips. So, join ATA, of course. Call me. I'm happy to talk to people and give names of other audiologists, but definitely start. You may find out it's not what you want to do, and you may find that this is exactly what you want to do. You develop deep bonds with your tinnitus patients, very, very deep bonds. I have, 20 or 30 really close audiology friends who have tinnitus clinics, and we talk about it all the time, that they always want to be there, they care for them, they have big hearts, and it's extremely rewarding.
Thank you. And finally, to wrap up our conversation here, Torin, do you have any advice or final words for someone who's watching this who does have bothersome tinnitus?
Well, obviously, they can go to the ATA website and mine through all of our devices, things that we recommend. We have some tools also for patients there. We have an if-then tool. If you're feeling this, then go see this person. If you're feeling this, then it's been very, very popular. We also have a calming flyer where it talks about the steps first. Understand that there's hope. Understand that there are treatments out there. So you can go to the website. That's free to anybody. There's nothing behind the paywall except the magazine, and the magazine right now is not behind the paywall. Another thing is, if you call and you are in distress, obviously we will ask you to call a helpline, a distress line first. But if you do want to have an intake of about 15 or 20 minutes, we're happy to take your name and give that to the audiologist to call you back. But really, that is for those that are having very much difficulty. It's not an informational line. The staff will help with the information. But take advantage of what we have. We have been building this now for quite a few years, and we are the place to be. We are the only organization in North America that only focuses on tinnitus. So you're going to find what you need from us. We're here for you.
Thank you so much, Torin. This is Torin Brazel, who's the CEO of the American Tinnitus Association, the ATA. Thank you so much for being here. It's been such a pleasure. And we're going to sign off here. This is the Tinnitus Virtual Summit. So take care, everyone.